Welcome to today's program, ACA Update, brought to you by the National Coalition for Cancer Survivorship. My name is Rebecca, and it is my pleasure to be your moderator for today's session. For technical assistance, please send an email to canceradvocacy@compartners.com or send a message in the chat box. Today's program is scheduled for 60 minutes and includes a question and answer segment. Please note that today's session is being recorded and all participant lines will be muted during this session. If you need assistance at any time during the program, please select *0 and the operator will help you. During our designated Q&A break at the end of the discussion, you may ask a question by selecting *1 on your telephone keypad or by typing your question in the chat box area located on the lower left corner of your screen. These instructions will be repeated later in the program. To interact with the presenters, you may submit a question at any time using the chat feature located on the lower left side of your screen. Your questions will not be viewable to other attendees. If you look to the left of the screen, you will notice the links area where you will find resources related to today's program. If you would like a copy of the presentation, click on Slide Presentation to open and print a copy of the slides. And now it's my pleasure to introduce today's first speaker, Shelly Smith, CEO of NCCS. Shelly, welcome to the program. Please begin.
Thank you very much, and thank you all for joining us today. It's been a couple of months since our first webinar on the Affordable Care Act earlier this year, and quite a bit has happened since then. I want to thank all of you for your help in talking to your members of Congress, attending town hall meetings, and really making the voices of cancer survivors heard in this discussion. I also really want to thank the NCCS staff, who's done a great job of keeping up with this fast-moving legislation and really being aggressive advocates for cancer survivors on the Hill and on Twitter, on Facebook, and really trying to get the message out about how the Affordable Care Act has helped cancer survivors and why we need to protect the patient protections and access to affordable health insurance that are in the Affordable Care Act. I think that it's safe to say that at the beginning of this year, we wouldn't have predicted that come April 6th, the law would not have been repealed. We really thought that that would happen, at least in one house of Congress, because they had the votes to do it. And the reason that they weren't able to yet is because of hearing from people like all of you that this law matters to people and has helped people with conditions like cancer and pre-existing conditions make sure that they can have access to insurance. I think that we all breathed a little bit of a sigh of relief a couple of weeks ago when we heard that the bill, that they did not have the votes in the House of Representatives, but the truth is that it is definitely not over. There are still legislative efforts to try to undo the Affordable Care Act, and there's a lot of things that the administration can do to weaken or at least not strengthen the markets of the Affordable Care Act so that people have access to insurance. So thank you for joining us today to hear more about this. And I'm going to turn it over to Lindsay Houff, our Public Policy Manager, to give you a reminder of what's at stake for cancer survivors in the Affordable Care Act and then what's happened to date.
Thanks, Shelly. Good afternoon, everyone, and thanks again for joining us today for an update on all things ACA. So like Shelly said, NCCS has been meeting with congressional offices, analyzing proposed policies and their impacts, and working to make sure that survivors' voices are heard throughout this entire process. Back when we hosted the ACA webinar in January, there have been countless developments, and we just want to make sure that everyone stays up to date on all of these developments and how they could affect cancer patients and survivors. So let's see, next slide. There we go. Okay. So first, I just want to give a quick ACA refresher. I'm going to review some of the most critical protections that the ACA provides to cancer patients. The ACA provides protections against exclusions due to pre-existing conditions. So before the ACA, insurers could deny coverage to individuals based on their health status, and now, thanks to the ACA, this is illegal. The ACA also provides protections against lifetime and annual health care spending caps, limits out-of-pocket maximums, and requires insurers to cover what they call essential health benefits, which include services like hospital visits, prescription drugs, and inpatient and outpatient visits. The next slide here shows a list of the many consumer benefits that Americans enjoy under the ACA, which cover critical things like preventative care, Medicaid expansion, allowing young adults to stay on their parents' plans until the age of 26, financial assistance, and much, much more. The ACA isn't perfect, but it's a huge step in the right direction. Before the ACA, cancer patients were often denied coverage for having a pre-existing condition, or even if they were covered, patients face outrageous out-of-pocket costs with little or no financial assistance. The ACA has given cancer patients unprecedented access to health care, and as we all know, positive health outcomes are closely tied to access to quality and affordable insurance. Republicans in Congress ran on the promise to repeal or replace Obamacare. But now that Republicans have the majority in the House and in the Senate, it's a bit like the dog that caught the car. So now they own the ACA. And actually, earlier this week, a Kaiser Health tracking poll affirmed that the public actually does indeed believe that Republicans now own the ACA and its outcomes. So now their party is divided over how to address health care between members who want to completely repeal the ACA and those who want to build upon the law or at least stabilize the marketplace in the meantime while they work on a replacement plan. So this brings us to Republicans' first proposal to replace the ACA, which was called the American Health Care Act, or AHCA. 2 weeks ago, after very little debate, they introduced the AHCA. And this bill would have been devastating for cancer patients, as it would have allowed insurers to charge older adults 5 times as much as younger adults. With cancer disproportionately affecting older Americans, this proposal would have been especially harmful to cancer patients. The AHCA would have also eliminated the Medicaid expansion, which has given millions of low-income Americans access to health care. And according to the CBO report, the Congressional Budget Office report, the AHCA would have left 24 million Americans without health care coverage as early as 2018. The AHCA did attempt to keep a few of the most popular provisions of the ACA intact, like protecting patients from being denied coverage due to pre-existing conditions, but this was actually contingent upon having continuous coverage. So if a cancer patient for any reason had a lapse in their coverage, they would have been penalized with a 30% premium increase when they re-enrolled after the gap period. The AHCA made it out of the necessary House committees in just a couple weeks without amendments and without hearings to include the patient perspective on the bill. But the bill did not make it to the House floor for a vote, as you likely know. Like many of you, we breathed a small sigh of relief when Speaker Ryan withdrew the bill and declared that the ACA would be the law of the land for the foreseeable future. Like Shelly said earlier, one of the major reasons that the AHCA failed was because of advocates like you who called their members, attended town halls, and scheduled district meetings to tell your story and let your members of Congress know that the bill would have been terrible for cancer survivors. Another reason the bill didn't get enough Republican votes was because Freedom Caucus members didn't think the bill went far enough, if you can imagine. The proposed elimination of the Medicaid expansion was also a deal breaker for several Senate Republicans who wrote a letter to leadership articulating their reservations about this. And since the AHCA was introduced, several states have actually taken action to expand Medicaid. Kansas just passed the expansion in their legislature, but then it was vetoed by their governor. Although the failure of the AHCA was a small victory, make no mistake, the fight to protect access to affordable health care for cancer survivors is far from over. Talks of repeal or replace quickly resurfaced, and the newest proposals are even worse than before. We were making updates to our webinar just this morning as new developments were coming our way. Republicans today released an amendment that would set aside money to help lower premiums for sick people, providing $15 billion for states to reimburse health insurers for covering those patients. The $15 billion would be spread across states over almost a decade. So in the grand scheme, it's actually not a lot of money. And this morning, the Kaiser Family Foundation stated that it's nowhere near enough money to cover a meaningful share of the claims for high-cost patients. In addition to advocating for high-risk pools, which we know drain money and don't provide affordable coverage to patients, the new Republican framework would eliminate the essential health benefits that I outlined earlier in the webinar. They have also proposed to get rid of community rating in the ACA, which bars insurers from charging sick people more than healthy individuals for the same insurance policy. And without it, the health law's pre-existing provision is all but meaningless. Guaranteed access to insurance without any rules about what it would cost means protections for people with pre-existing conditions like cancer are completely deceptive. And it's not just Congress who can impact the ACA. The administration has leverage to either strengthen or weaken the ACA marketplace through a number of ways. The administration could withhold cost-sharing subsidies, which would wreak havoc on the marketplace and cause even more uncertainty for insurers. Outreach and enrollment assistance were critical to the success of previous enrollment periods, and an administration that is not behind the ACA could scale back or eliminate support of enrollment assistance. In fact, back in January, the Trump administration announced plans to eliminate advertising near the end of the enrollment period. So now that we've given the update on where the ACA stands and efforts to repeal, here's what we need to do. Starting tomorrow, Congress will go on a 2-week April recess, and this will present constituents and advocates with multiple opportunities to remind your elected officials that the majority of Americans oppose repealing the ACA. Members of Congress must hear the simple message: do not take away our care. Stop trying to repeal the Affordable Care Act. And today, we actually have a special guest who will be here to give some tips on contacting your members of Congress during recess. And before Amy, Amy, are you there?
I am.
Oh, great. Amy's here. And Amy is the Senior Policy Advisor for Congresswoman Jan Schakowsky's office, and she serves the 9th District of Illinois. And Amy's going to talk a little bit about how advocates like yourselves can influence members of Congress and give some tips on contacting members and attending town hall events.
Thanks, Lindsay. And thanks, everyone, for your efforts on this issue and your and giving your time today to figure out how you can stay in the fight. First I just want to say, repeat something that my boss says all the time, which is that grassroots activism is how we won this fight so far. There's a reason that the bill didn't come to the floor, and it's not because Republicans didn't want to repeal the ACA. It's because they knew that doing so would possibly cost them their seats and certainly give them a lot of backlash. And you saw a lot of moderate members oppose the bill, in part because of the Medicaid cuts, but in part because they knew that their jobs were on the line should they vote for this, and that was only possible because people went to town halls, because people called, because people got active. And, I really just want to encourage everyone to keep up the drumbeat because, as Lindsay said, this battle is not over. We had a really great victory, but we continue to hear different rumors about what's coming. As Lindsay said today, they offered an amendment. We think this is really it doesn't seem to actually move the ball forward in any real way. It just seems to be really optical for them to pretend as though they're continuing their efforts to repeal Obamacare. But as Lindsay also mentioned, they are discussing repealing the essential health benefits, and that's really critical because that includes things like chemotherapy and hospitalization and emergency care, but it also includes things like maternity care, which before Obamacare became law, in the individual market, only 12% of plans covered maternity care. It includes mental health, and I think anyone who's ever suffered a mental illness knows how difficult it was for them to get their treatment. And I think that's still a problem, but the fact that they're required to cover it, we obviously have a lot to work to do in terms of actual access on mental health, but we would be taking a massive step back. And then secondly, on community ratings, that is how insurers how insurers charge patients a lot of money for their insurance. They'll still be required to issue that insurance, but they won't be required to cover the benefits that you need, and they'll be able to charge you whatever they want for it. So it's really not, we should not see that as a victory. But, on the point of community rating, and, that gets us to the larger point of pre-existing conditions, that's how we won the Affordable Care Act to begin with, and I think that's where all of you can really play a large part. That is something that Republicans can't get past. They know they have to protect people with pre-existing conditions. When we were in our energy and commerce markup, a lot of the moderates on our committee were, going on and on and on about how they were protecting people with pre-existing conditions. You've heard Republicans in the media say that that's such an important part of the bill, but now they are discussing undoing it. And I think that these 2 weeks coming up, it's really important that you really make it clear that ACA repeal needs to go away forever. And anything that might harm people with pre-existing conditions will never be accepted. And then, going into some tips. So first of all, call your member of Congress. Even if they agree with you, call them and say thank you. When we get calls that last all day, every member of the staff has to stop what they're doing and pick up those phones. When the congresswoman walks through the office and she hears the phones ringing nonstop, she says, "What is everyone calling about today?" Each week we go over the top, issues that people called and emailed about. And those, she always is very thankful that so many people have been calling in opposition to the Republican repeal bill. Secondly, go to town halls. Get there early, ask a question. And the way to find out about town halls is by going on your member of Congress's Facebook page or even just calling their office and saying, when will you be holding a town hall? Usually if they have them, they will advertise them. I would also say some groups have gotten creative. There's been some community forums that haven't been billed as town halls, but constituents have shown up and organized and gotten there early and gotten in the door, and they've turned into town halls. That's how a lot of those kind of viral moments happened. They weren't official town halls. So if your member isn't having a town hall, think about where they might be having a public meeting of some kind, a public event of some kind, and really make sure that they know that you have serious concerns. And I think also it's important to remember that we live in the age of social media. I think all of us have seen that video of Tom Cotton's constituent yelling at him about the Affordable Care Act. Those things matter. Those things get played on the news over and over and over. And so, even if you just think, well, it's just my community, who's going to notice? People notice. These things, the press is following this stuff. And so, I just think it's really important over the next 2 weeks to really keep it up, to not give them an inch, because they will be spending these next 2 weeks trying to figure out how to get a repeal bill back together.
Thank you, Amy. This is Shelly. We really appreciate your perspective. And in fact, I was reading the news that they are, saying they might bring everybody back from the recess if they think they have the vote. So it's so important that you get your message out there during this 2-week time period. Thank you, Amy, for sharing your perspective as a staff member who gets to field these calls, because I think it's really important to hear from you and how we go about making these calls. So we're going to open it up now to questions, and while I give you a few minutes to think about your questions, I just wanted to add a couple of points that I was thinking about as I listened to Lindsay and Amy. Really, in addition to helping kind of kill kill the vote on the American Health Care Act, all of the activism of people going to town halls and talking about how important their health care is has really shifted attitudes about the Affordable Care Act. Because, the polling on the support for the Affordable Care Act has steadily increased throughout this year as more people sort of realize what was at stake. Repeal and replace was really just a political slogan. It wasn't a policy. And when the rubber hit the road and we saw what that would mean for people, people realized they don't want to lose that. So the support for the legislation among individuals who benefit from it has gone up. But also it's changed the views of people in Congress. I was reading a pretty remarkable statement from a member of the Republican leadership who said, there are provisions I've campaigned for 4 election cycles that are part of the law now I want to preserve. So if you look at a cross-section of the conference, meaning the Republican conference, they have similar positions about similar provisions. Pre-existing conditions, guaranteed issue, and medical underwriting are components of that. So I think all this activism has sort of changed the view of what people expect and demand, and so that even people who've campaigned on this are now realizing they can't take it away from people. We have done some special outreach to some of you who we know live in the districts of the moderate Republicans who are the most likely to be swayed by constituent pressure. That's not to say if your member of Congress is in the House Freedom Caucus, you shouldn't be letting them know, because you should, but they're not as likely to listen. And if your member is a Democrat, as Amy said, call them and thank them for their support. They still need to hear from you that it's important, but there's really been no, the Democrats are firmly behind protecting the Affordable Care Act. So if you call them to say thanks and to remind them why it's important and to share your story, but not with an angry call, because they are really on the side of trying to protect the Affordable Care Act. We'll also, as this continues to evolve, and if something makes it to the Senate, we'll also do special outreach to those of you who live in states where the senators are particularly, vulnerable because either the state has expanded Medicaid or they may be up for re-election. There's a subset of individuals that are really the true targets that are the most swayable, and in the House it's, roughly about 30 members. Everybody should be letting their members of Congress know, but if you happen to get a call from us saying or an email from Lindsay or Kelsey saying your member is particularly important, it's really important that they hear from you, and to the degree that you would be willing to share that with others that you know who might be willing to call those people, they're the ones who are the most likely to be swayed by the number and quality of the calls that they get from their constituents. So now that I've been talking, I wasn't looking at the questions, and I will go back to... Amy, are you still on? Okay, Lisa asked the question, does your office collect zip code information from callers to determine if the callers are constituents? If Amy's not on, I'll just venture an estimate or an answer for that. I think it varies. Some offices are very... particular, they do not want to hear from anybody who's not their constituent, and they will ask where you live. They may not ask your zip code, but they may ask where you live. Others are more willing to accept calls from others, but I just don't think they're nearly as effective. Particularly, I think I think sometimes the leadership of certain committees sort of understand that in leadership roles they may expect to get calls from people who are not their constituents, but it's never going to be nearly as effective as getting a call from a constituent. And some really are very particular about that. Okay, so here's a question from Christina. And I think we can also, after I answer this, we can go to phone lines if people have any questions on the phone. My district is represented by a Democrat supportive of the ACA. My senator refuses to have town halls, and his box is full or we are unable to get through. What options do we have to advocate with our reps in these situations? I'm a social worker, and many of our patients are asking these questions. So I think that we've heard this from in other instances where they don't hold meetings. We've even heard of crazy stories of people just shutting their offices because they were getting so many people coming to them, which is really distressing because that's their job, is they are accountable to you as constituents. One thing you could definitely consider is writing a letter to the editor or an op-ed for your local paper about the fact that you cannot get through to your senator, and that you have patient stories of people you work with who really want to share that with your senator, but you're unable to have have an audience with that person. I think that would be something your local paper would be interested in publishing, and if you want any help with that, you can contact us. We could help you write that, because I think it's really their job to listen to you, and if they're not willing to, then you have to find other ways, and they don't like bad press.
Shelly, this is Kelsey.
Yes.
One thing to add to that is you to also consider if people have access to social media, using their Twitter handle or Facebook. Sometimes that's effective as well.
Now, some people are also holding a town hall meeting, and inviting the member to it. And when the member doesn't show up, they're still taking pictures of the seat where the member would be if they'd showed up, and sending that out to the media and via social media. That's definitely a bigger lift, but it's something you could do, especially if you have a group of people who would be willing to work with you on it. And again, we could help you if you wanted to do that. I think it can send a powerful visual signal that, we had a meeting and he didn't show up or she didn't show up.
And Kelsey's email is on this last slide, so feel free to email her if you're interested in having us help you set up a district meeting during recess. We did that for many folks during the last recess, and I think that, that was effective. So if you're interested in having us help you set up a meeting, we can certainly do that.
We do hear from staff members and members of Congress that the meetings in the district are more effective than in D.C. That's not to say the D.C. meetings aren't important, but there's just they're a little bit more relaxed when they're in the district. Except I guess if they're at a town hall where people are screaming at them, but they also have fewer. I can't remember who told me this recently. They don't have their staff members there to tell them, no, we can't do that. So they sort of make promises and say they'll do things that if they were sort of handled by their staff members in D.C., they might not be able to do. So it's, and then I think too when they see, I've heard members say that when they see the same people multiple times, both in the district and in D.C., then they know like that person really is serious about this, and they pay more attention, I guess, than when they get a random phone call, when they hear from somebody on a regular basis. So there's another question here. Does it make sense to fax or mail a letter to those in Congress? I think mail is not as ideal anymore just because it's gotten harder to get things through. I don't know about fax anymore. You're saying, Lindsay's shaking her head, yes.
I just recently read an article, and they interviewed several staffers just saying that basically they just keep a running spreadsheet and they, catalog every call, every fax, every correspondence that they get, and then categorize that based on the topic. So, if they're not picking up the phone or if they're not holding a town hall, definitely get creative and try other ways, for sure, or try all of them.
Yeah. I think that, email used to be really popular because there's a lot of email programs that make it easy for you to send the letter, but they don't see the customization. So I think they can tell a difference between someone who's really telling their story about something that's important to them and somebody that's reading the talking points of an organization that told them to call.
Right.
And obviously we want to support you and give you talking points, but if it sounds like you don't really, you don't fully buy into what you're saying, that they notice that. So that's where I think the talking points are a guide, but what you need to do is sort of put it in your own words and your own perspective. That's why I think sharing stories of people who've been helped is really very helpful.
And if you feel comfortable, share those stories with us as well, because, for our meetings, it's really great to be able to take your stories and put a face to the patient when we're talking about why the ACA is so important and what this would do to real people in real states and districts and their constituents.
And also we can, if you're willing to let us share it with media, we have talked with health reporters they're always looking for someone to help illustrate a particular policy point who's had that, who's affected by that policy. And I think that, local media, if you happen to have any relationships with local media, that we could help you, work with you, because I do think the local media is going to be really important. I think, the national media and then the organizations that really cover politics and policy are very in the weeds on health policy, but I think that in the local media there's still a need for more explanation of what's going on, and we could certainly, if you have relationships, we could help you sort of pitch something to them, or we could do that for you or with you. So do we have any questions over the phone?
Just as a reminder, if you'd like to ask a question over the phone, you can do so by selecting *1 on your keypad. Please note that you will be put into a phone queue, and the operator will announce when your line is open. And Paula, do we have any questions over the phone line?
And there are no phone questions at this time.
Okay, here's another question from Gilda. And she's asking, what would happen to someone who's been healthy and then gets a cancer diagnosis? Could their premium go up when they're diagnosed or when they have a reoccurrence? I think, depending on how they decided to change the law, that could, under the Affordable Care Act, your premiums are not based on your health status. So if you're diagnosed with cancer or have a recurrence, it should not affect your premiums. With some of the changes that have been proposed and that Republicans have considered, that could happen, yes. So one of the big issues is that people are concerned about affordability of health plans. And for people who are healthy, the plans under the Affordable Care Act may be more expensive than what they had before, or if they didn't have anything before because they didn't feel like they needed it. So if you are completely healthy, then you may be paying more, and I think they want to make it more affordable for those people. Well, the way to do that is to cover less, and so that does not help people who do have a chronic condition or who have a history or have a cancer survivor who are concerned about a potential recurrence. So I think their efforts to take out some of the protections to bring down the cost of premiums for healthy people will result in driving up premiums for people who have medical conditions if they're able to remove some of the patient protections, and that's why we're very concerned. So under the current law, no, your premiums would not go up for that. They could go up because costs in general are going up, but they couldn't go up specifically because of a diagnosis or recurrence. But under the changes that are being discussed, they could go up. Not necessarily, well, there's a lot of changes that they're talking about in their efforts to revive the AHCA. Are there any other questions?
And there are no phone questions.
Great. Well, thank you all so much for joining us. We really appreciate it. And again, thank you to our team at NCCS, Lindsay and Kelsey and Elizabeth Goss, who's been on the phone with us and who's been helping us navigate this kind of crazy time here in Washington. But again, you all are the ones that the members of Congress want to hear from, and it's because of hearing from people like you that we've made the progress that we have, and we still have a lot more work to do. So thank you very much, and please be in touch with us if there's anything we can do to help you. Have a great day.
And with that, we must conclude today's webcast. If you take a look at the links box on the left-hand side of your screen, you will see the webcast evaluation. Please take a moment now to complete the evaluation to give us your feedback on this program. Then click on the Submit button when you've completed the evaluation to send us your responses. Your comments and suggestions are very important to us, and they help us to provide you with this kind of quality programming. Today's program is copyright 2017 by the National Coalition for Cancer Survivorship with all rights reserved. This concludes today's program. Thank you. You may now disconnect.